I'm very excited about the whole kind of domain of pediatric migraine, both as a clinical and as a research interest. So we know that migraine is actually really common in children and adolescents, and we know that it's very disabling as well. It's very common for these children to present to the emergency department with a migraine because they're in such severe pain during their headache. And unfortunately, despite how common and how disabling it is, there's just not a lot of evidence about what we should do with these children in terms of when they come to the emergency department and what therapies are most effective. So it was a great honor. I was actually asked to lead a team of experts in the world of headache to look at the evidence that we have in the adult population about what therapies are effective to manage migraine in the emergency department. And I worked with people from across North America, some from New York, Massachusetts, a local expert from Ottawa, and we looked at just over 2,000 studies and tried to narrow those studies down to the best quality studies that were looking at migraine in the emergency department and what therapies to give to adults in that setting. So we narrowed it down to about 68 papers, and then we reviewed those papers in detail, and we actually came up with evidence-based guidelines about how to manage migraine in the emergency department in adults based on all of those studies. In brief, these guidelines looked at two big questions. So one was, what therapies are effective for reducing migraine pain in the emergency department in adults? And the second question was, do we have any interventions that can actually help to decrease the chance that you're going to get another headache, or that the headache will stay with you after you're discharged from the emergency department? The reason we looked at adults is because we know there's just such few studies, unfortunately, in children and adolescents, and this was a starting point so that we can see what's out there in the adult population and then hopefully use that information to inspire future studies in children and adolescents.